I'm Dr. Clary. This is my assistant Willow. We're going to have some patients coming in soon. Talk to us about some of the symptoms that they're kind of scared about. So what seems to be the problem here, young man?
I don't know.
He's got these really yellow eyes with a brown ring around them, and also he keeps randomly slapping himself. He also has been gaining some extra weight. I don't know if it's bloating or what's going on, but we haven't changed his diet. So can you help us out with this?
Yeah, interesting. Do you have any patient history? Is there anything in your family that may have some of these symptoms?
No.
Patient seems to be having involuntary movements, which is usually associated with Tourette's syndrome. Patient also seems to have some type of jaundice in the eyes, along with what seems to be brown rings around the eyes, the cornea, associated with Kaiser-Fleischer rings, possibly. And then as we move down to the abdominal area, it seems like he has some type of edema, possibly abdominal edema. Has your family shown any similar symptoms in the past at all? Anything that you're aware of?
Not really. I mean, his father did have some random bloating and the yellow eyes. And other than that, we went to go get testing, but unfortunately he passed away the same day. A refrigerator fell on him, so.
I'm very sorry to hear about the loss of your husband. I know it's very difficult. But as we're looking at your son here, some of the things that I'm seeing are the yellow eyes. We call it a jaundicing, kind of going in the eyes. We usually associate that with something like kidney failure. There also seems to be a certain type of brown ring going around the area. We usually kind of associate that with what we call Kaiser-Fleischer rings. And then I'm also looking at other things such as the stomach. It doesn't seem to be like a fat buildup. It seems more like a fluid, an excess of fluid, which is known as an edema. So we're looking at a type of abdominal edema. And then there's also the involuntary movements that your son is showing. That can be sometimes connected to something called what we call Tourette's syndrome, which is an issue that occurs in the brain. But obviously, right now, I have a lot of symptoms and a lot of things that I can work with. I would like to run some blood tests to test some things. If you're willing to do that,
Yes.
just to get a better diagnosis of what we're dealing with here.
Yep.
Hi, Nate.
Hi, Doc.
This is Miss Denun.
Hi, Mr. Dunn.
She's going to be taking some blood so that we can make you better, okay?
Okay.
But we have to do it, all right? It's going to hurt a little bit.
Okay.
It's going to pinch, but it'll be over quick, I promise.
Yeah.
Many hours later.
So the blood test came back. Your son did end up testing positive for hemolytic anemia. And we also did do some testing in the serum ceruloplasmin levels as well. Those came back really low, lower than 10 milligrams per deciliter. And looking at the presentations that your son has with the abdominal edema, the jaundice yellow eyes, along with the brown rings around the cornea area, and the involuntary movements, I think it's pretty safe to say that your son has what we call Wilson's disease. And after looking at this, we did actually do some research, and we did find out that your father and your husband actually did have a mutation in what is called the ATP7B gene, which is associated and the only cause of Wilson's disease. So it's a genetic disease. There's nothing you could have done to, cause this. This is purely just bad luck, or, you couldn't do anything. But here's the blood work. From here, some of the things that Wilson's disease kind of consists of is it's this excessive copper deposits, which are usually associated, especially in the cornea of the eyes, the brain, and as well as the liver. So the brain, the involuntary movements, the cornea of the eyes, so that'd be the Kaiser-Fleischer rings are usually pretty big things. Serum ceruloplasmin levels are really key. Here's kind of a pamphlet of more information, just kind of dealing with Wilson's disease and what it entails. I myself do not know a whole lot about it. So I do have a good friend that I know of. Dr. David is his name. He's the best in the world for this thing. Here's his pamphlet, kind of more information on him. I did end up giving him a call, and he said he was going to come and stop by and give you some more information on what he can do as far as like treatments and things like that.
So, doctor, am I gonna die?
No, not at all. We're going to get this under control, get your copper deposits at a good level, and then you'll be back to normal.
Did someone say Wilson's disease?
Dr. David!
Hey!
So as Dr. Clary said, Wilson's disease is only caused by mutation in ATP7B gene, which means you have too much copper in your body. Copper is not eliminated properly, so we have to decline the level. As a treatment, I'll give you D-ampicillamine or ammonium tetrathiomolybdate or trientine. But you're lucky because I got a new treatment, which is intranasal. Do you want to try intranasal? It will
Yes.
cure you completely.
Yes, I do. I really want to try it.
Okay, son.
This is intranasal. It may hurt you a little bit, but it'll work.
Stay, please. Please stay. Please stay, please stay. Stay, please stay. Stay.
How do you feel?
I think I'm better.
You're not cured. You're too weak.
No.
He's still your friend. This is heavy metal toxicity medication. Take this twice a day.
Wait. No, Doc, please. You gotta help me. You have to help me, please. Please.
Security!
Help me. Please.
Disgusting.
Help me, please. Please, no. You have to help me.
I want to be TikTok famous.
Open eye, feel the waves cut through me, hypnotized by the sounds I'm breathing in. Hold tight, chemicals